Hello, everyone, and welcome to the Brunch Hour with Acupuncture is My Life. I'm Dr. Lott, and today's topic is pretty interesting but basic. We're discussing, or I plan to discuss, COVID-19 and smoking. Why is that? Because over the past weekend, and I will say here in New York City, it's snowing and the snow is beautiful, and you may hear some snow blowing and things like that, but this is great. It's great. This is a great time to discuss smoking and COVID-19. Because over the weekend, I've approached a few smokers, when I was going into the supermarket or hardware store or different places. And I asked them the simple question. At a time like this, being in the pandemic that we're in, why are you smoking? Now, I've had, let's say, about 8 people that just walked away, didn't want to answer or acknowledge my presence or the question that was asked. I've had some that said they use it to calm their nerves because they're stressed. And I can understand that, especially at a time such as the time in which we're faced with now. It's not just a New York City thing, it's not just a United States thing, it's a global thing. And what happens here in a situation such as this is that we have to persevere mentally. We have to get past, what we're faced with for our own personal health and wellness. Now, there were those that, outside of saying it's there to relax their nerves, there were those that said, I really need to stop. And bingo, I was really feeling that. I was really feeling that response. Just the simple fact that they're aware that they do need to stop. And with being faced with the COVID-19 pandemic, this is the best opportunity for people who smoke to recognize the serious health risks that are associated with the addiction, and they should consider quitting smoking. It's common knowledge that smoking is bad for your health, and when it comes to the COVID-19 pandemic, the side effects of smoking and the behaviors of people who do smoke could create a 1-2 punch. Because smoking injures, let's say, within the body. Now I want to get into anatomy and physiology a little bit. Well, not too deep, but just stay basic in just saying that smoking injures the local defenses in the lungs by increasing mucus production and inflammation, which is bad for the body. And that's why people who smoke are more likely to have serious respiratory infections and illnesses such as like the flu, pneumonia, COVID-19. Hello? Like I said, this is a better time than ever to consider quitting smoking. Because people who smoke, they're generally at more risk for more serious COVID-19 infection, and they're more likely to get even critical disease and have to be hospitalized. And most times, well, I won't say most times, let's stay corrected. There are cases of those that have been hospitalized and have been put on ventilators and succumbed to COVID-19. I mean, you have to think deep, long, hard. Is smoking worth it? When you know the realities of smoking, there's really nothing good about smoking. It's not beneficial to you in any way, shape, or form. The social behavior of smoking it generally can increase the risk of spreading the virus. And a lot of people aren't aware of that, because as people smoke, oftentimes they smoke in groups. And the virus easily can be transmitted as a person picks up an object and then puts it near an unmasked face, such as a cigarette, borrowing someone else's cigarette lighter. You see, smoking, hand-to-mouth, social behavior. Most cases when you're smoking in the group, you're not socially distanced, you're unmasked, and you're exhaling and inhaling deeply. Think about it. Creating an aerosol of droplets. And those are all the ways that we know this virus spreads. So it's very likely that people who are engaging in these behaviors are more likely to get the infection and spread it to others. So these are things, that we have to think about, But when you look at it from a Chinese medicine perspective, smoke is basically a poisonous substance, and long smoking may lead to like an imbalance of yin and yang in the human body, and disturbances basically and I'll repeat, smoke is a poisonous substance, and long smoking, it can lead to an imbalance of between yin and yang in the human body, and disturbances in ascending and descending of qi and blood, which can lead to, let's say, like a series of pathological changes. So, acupuncture does help with smoking, in reducing the amount of cigarettes you smoke a day, to eventually you can stop smoking. There are different treatment modalities under Chinese medicine that can assist a person in quitting smoking. You see, smoking, when it comes to Chinese medicine, it impairs lung qi. Like after entering the body, and I'm speaking of smoke by way of the mouth and nose, the smoke first, it invades the lungs and it causes an accumulation of pathogenic factors in the organ and a myriad of functional disturbances. That's why most smokers suffer from cough, expectoration, and gasping. Now, also in Chinese medicine, smoking can cause lung deficiency, which would involve the kidneys. Now, if any of this sounds like really strange to you, you can go to the Acupuncture is My Life YouTube channel. And on that channel, we get into the basic functions of the visceral organs, the meridians, and thousands have watched it and have come to understand or get a clear understanding of Chinese medicine and how it's awesome, and in acupuncture, everyone's body's different. Everyone's constitution is different. It's not a one size fits all. So you only just get one particular treatment protocol for this disorder and another for that disorder, or one herbal formula for this disorder, or another for another disorder. It doesn't work like that. Chinese medicine and acupuncture, which is an actual technique under the umbrella of Chinese medicine, everyone's constitution is different. The season you were born, the year that you were born, the time of day you were born, is all factored in when putting together a treatment protocol, when conducting a thorough diagnosis of a patient. Now, when it comes to, let's say, lung deficiency involving the kidneys, you see, the lungs are in charge of expiration of qi. while the kidneys control the inspiration of qi. Both of these organs, they work together to complete the process of respiration when it comes to Chinese medicine. So therefore, like, a failure of the lungs to perform its function can also lead to a weakness of the kidneys and a series of syndromes characterized by deficiency of kidney yin and kidney yang can develop. You can also suffer from hypoactivity of yin and hyperactivity of yang, where liver and kidney, they basically originated from the same resource. They're both found in the lower jiao. The body has three jiaos: the upper jiao, which has the heart and the lungs; the middle jiao, which is predominantly controlled by the stomach and spleen, and that's where your postnatal qi comes from; and the lower jiao, which consists of your liver and your kidneys. So, when you have deficiency of kidney yin, it may also result in a deficiency of liver yin. So in the case of yin deficiency of both the liver and the kidney, the deficiency of yang will become hyperactive, because you see, yin and yang have to be balanced. That represents homeostasis in the body. So when yin and yang fall out of balance, many disorders present. So basically, again, in the case of yin deficiency of both liver and kidney, the deficiency of yang, or not the deficiency of, but I could say deficient yang, will become hyperactive and change into pathogenic wind, which will lead to like the shaking of your hands. And that's why excessive smoking can cause dizziness or vertigo. Have you ever seen someone who excessively smokes, like their hands shake when they're not smoking? That's an example of pathogenic wind in Chinese medicine. A person can also suffer from, let's say, qi deficiency of the heart and lung, which represents the upper jiao of the body, the human body. You see, the lung is the master of qi and the heart is the master of blood. So wherever qi goes, blood follows. So if there's a stagnation of qi or blood stasis, the deficient lung qi, it can lead to deficient heart qi. And long-term smoking is therefore the most risky factor that leads to chest distress, shortness of breath, palpitation, and even mental uneasiness. Think about it. If you're a smoker, do you experience any of this? And then having to go back and think, do I really need to be smoking at a time like this? Another of many, but I'll just go with this one, is qi deficiency of spleen and stomach, which, boom, your middle jiao, which is responsible for your postnatal qi. That's the qi that's created after birth. Prenatal qi, which comes from the kidneys, is before birth, pre-birth. Postnatal qi, post-birth. The middle jiao is so important that I will do episodes that'll discuss spleen and stomach and the importance of your diet, the time you sleep, and so forth, and stress. Your stomach being your second brain. We're going to get into that in future brunch episodes on Acupuncture's My Life. But qi deficiency of the spleen and stomach, you see, with deficiency of kidney yang, that can induce deficiency of spleen yang, leading to weakness of the spleen to transport the body fluids and leading to the accumulation of sputum. And this is where you ever listen to smokers talk or they're like making these hawking sounds as if there's like so much mucus. There you have it. That's how it's described in Chinese medicine. Whereas in the same way, deficiency of spleen can cause a deficiency of stomach qi. See, that's why smoking can always cause disorder of the functions of the spleen and stomach. And it can result in a series of symptoms of the digestive system. Smoking is bad for you. So whenever you decide you want to take out a cigarette because you're feeling stressed, just think of one word, like every time you reach it for a cigarette, nope. That's what you should say to yourself. Seriously. Nope. It's not worth it. You see, you have to understand as to how the coronavirus moves throughout your body. You see, COVID-19 is basically an illness caused by the coronavirus. And it starts with droplets from an infected person's cough, sneeze, or breath, just from someone talking to you. And it could be in the air or on the surface that you touch before touching your eyes, nose, or mouth. And this is what gives the virus a passage into the mucous membranes in your throat. And usually, let's say, like within 2 to 14 days, your immune system may respond with symptoms, let's say, such as fever, a cough, shortness of breath, or trouble breathing. That like should set off all types of alarms. You know, smoking, shortness of breath, trouble breathing. Do you really want to continue putting that cigarette in your mouth? Do you really? But also there's fatigue, chills, sometimes with shaking, there's body aches, headache. And also smoking can dehydrate you. And one of the symptoms of dehydration is headache. To be accompanied with COVID-19 headache, really? Do you really want to continue smoking? There's also sore throat, congestion, or runny nose, and you can even possibly suffer loss of taste as well as loss of smell. There can be nausea, there can be vomiting, there can be diarrhea. You see, this virus, it moves down your respiratory tract. That's the airway that includes your mouth, nose, throat, and your lungs. Your lower airways have more ACE2 receptors. And these are the receptors that this virus binds with. You know, your lower airways, again, it has more ACE2 receptors than the rest of your respiratory tract, whereby COVID-19 is more likely to go deeper than viruses like the common cold. You see, your lungs can become inflamed, making it tough for you to breathe. Do you need the fallout or the negatives that come with smoking to accompany that? And, you know, as a result, this can lead to pneumonia, where there's an infection of the tiny air sacs, and these air sacs in your lungs are called alveoli. And the alveoli is where blood exchanges oxygen and carbon dioxide. Do you really want to continue smoking? What's that one word I said to use every time you're looking to pick up a cigarette? Nope. Think about it. Really think about it. You see, after a few days, you can develop like acute respiratory distress syndrome as a result of being infected. And this, see, acute respiratory distress syndrome damages the tissues and blood vessels in your alveoli. And remember, this is where gas exchange occurs. And it can cause like debris to collect inside of them. And this makes it even harder or even impossible for you to breathe. This is where, more times than not, when you're struggling to breathe, this is when you're placed on a ventilator in the hospital. Now, I have my own personal views of ventilators. I mean, can they save your life? Yes. But I'd be like super nervous to know that I may have to go on one or could possibly go on a ventilator. You know. But when it came to treating patients, from the perspective of Chinese medicine, like I've had cases where I diagnosed a patient who'd smoke more than 6 cigarettes a day, like as having like deficiency of both heart and lungs, and I spoke about that a little while ago, which represents the upper child. And in Chinese medicine, transferred over to Western medicine, deficiency of both like qi in the heart and qi of the lungs is the equivalent of bronchitis, pulmonary emphysema, coronary heart disease, neurasthenia in Western medicine. Whereas the main symptoms are like things such as cough, asthma, chest distress, chest pain, throat pain, and swelling, palpitations, shortness of breath, restlessness, poor sleep, and dreaminess. So if you are a smoker or know someone that's a smoker and they're experiencing these types of symptoms, you know, you may want to consider or have your loved one or the person that you know that smokes, having them sit with an acupuncturist. Now, another case, I've had several cases of this, as I think about it, that I've diagnosed as deficiency of liver and kidney yin from some of my smoker patients, which in Western medicine is the equivalent of hypertension and neurasthenia. And their symptoms were like dizziness, vertigo, tinnitus, impotence, seminal emission, irregular menstruation, and even sterility. You know, and again, if you know of a loved one who's experiencing that, or simply a colleague, or even yourself, again, sit with your local acupuncturist. You can even contact like Acupuncture is My Life, you know, at acupunctureismylife.com, you know, because we do telehealth. We do telehealth, and we have patients in different countries that we treat, we deal with. Of course, we can't do acupuncture, but we do train patients who are distant into performing acupressure on themselves. Other cases that I've diagnosed at my clinic with regard to smokers was weakness of the spleen and stomach. Again, middle jiao, which is middle jiao deficiency. Spleen and stomach is like super important. You really don't want to screw up your spleen and stomach. It affects your postnatal qi. It affects how you digest food, the types of mood you're in, the way that you think, how you sleep, how you feel overall, and how long you'll even live. You know, how much energy you have to perform your daily tasks. You know, but weakness of the spleen and stomach in Western medicine is seen as chronic gastritis and gastroduodenal ulcers, where the main symptoms are dull pain in the stomach, poor appetite, abdominal distension, loose stools, fatigue, heaviness and tightness of the head, and a greasy and sticky sensation in the mouth. So if you're a smoker and you're experiencing these symptoms, or know someone that is, you may want to recommend that they sit with an acupuncturist, or even contact Acupuncture's My Life. They can go to acupuncturesmylife.com and peruse the different things that we have to offer smokers to potentially help them cease smoking, especially at a time like this. Because I'm going to tell you, this virus, get used to it. Get used to it. It's going to be around for a while, and there are going to be others. And I'm not talking about like other COVID-19s. This is the new norm, and it's all about how you live your life. It's all about how you protect yourself. And in knowing that, knowing all of this, like, you have to come face to face with the fact that tobacco smoking in and of itself is a known risk factor for many respiratory infections, and it increases the severity of any respiratory disease you may acquire. So if this cannot convince you to stop smoking, I don't know what to say. I really don't. So again, knowing that COVID-19 is an infectious disease that primarily attacks the lungs. You know what cigarette smoking can do to the lungs. You know that smoking impairs lung function, making it harder for the body to fight off this virus as well as other diseases. You see, tobacco is also a major risk factor for non-communicable diseases like cardiovascular disease, cancer, respiratory disease, and even diabetes, which put people with these conditions at a higher risk of developing severe illness when they're affected with COVID or by COVID-19. So guys, ladies, think hard. Think hard about how much you want to continue smoking. It's mind over matter. It's just being proactive in the fact that, every time you pick up that cigarette, along with saying, nope, how much that cigarette can hurt you. Now, certain aspects of your lung tissue that becomes damaged is reparable. Some, over an extended period of time, is irreparable. But I won't get into that today. But I will say, is picking up that cigarette, buying a pack of cigarettes, really worth it? Is it? A lot of people are dying from this virus. And then the other thing that we have to worry about is the long haul. Because just because you become infected with this virus, you don't know the damage that this virus can impose upon the human organism. Because, there are those that have been infected months ago that are experiencing problems, heart problems, continued lung problems, headaches, fatigue, joint pain. They come to find out that they have problems with their liver, their kidneys, they have digestive problems. You see, your organs within the body, your kidneys, your liver, your heart, your lungs, they all have ACE2 receptors on it. And, this virus has an affinity for these receptors. So it's not just the lungs. Because when gas exchange is performed, now this virus is in your blood and it's traversing your body, and it can take up residence in any organ. So as a result, we we can sustain long-term damage. Totally unaware of the damage sustained till maybe like a year, 2 years, 5 years later, or even when we think of having children and cannot. It can possibly be the result of having been infected with this virus. So when you see your primary care physician, request a full CBC, talk to him or her about how you can go about having tests run or panels representative of how a particular organ is functioning. Along with that, it's best advised to sit with an acupuncturist to talk even further about the matter. Because being diagnosed from a Western perspective, a Western medicine perspective, and an Eastern medicine perspective, how can you go wrong with that? Both forms of medicine actually support each other. A lot of people are unaware of that. But in a quiet sense, but more people are recognizing, they make for a great pair, a great marriage. And in some cases, people have experienced disorders and have gone and had myriad of tests done, and MRIs or X-rays and so forth, and nothing was found. CBC, blood tests, nothing was found. And would go and sit with an acupuncturist or come into my clinics, one of my clinics, and after explaining which meridian was affected and out of balance, and educating them to the importance of yin and yang within each organ and how it should function. And when yin and yang is out of balance, it explains why you're experiencing certain symptoms. And, patients who walk out of my office amazed at the new perspective, at a new angle in which they can view and attempt to diagnose their problem, only to confirm one way or the other once they sit with an acupuncturist. It's always good to self-educate yourself. I don't believe that just because someone is an MD or a doctor of acupuncture and Chinese medicine, such as myself, that we're the only ones that know. A lot of times when you just simply sit down, research, and ask questions from these professionals that were trained in these areas, you'll be surprised. You'll be surprised as to how the wealth of knowledge you can gain from it and better take care of yourself. And it's not just acupuncture or allopathic medicine or just Chinese medicine. Well, I can't say Chinese medicine because it's an umbrella for a lot of modalities. There's different techniques, aspects of Chinese medicine. And another thing is Eastern nutrition. Acupuncture's My Life has a cooking channel on its YouTube channel under Acupuncture's My Life. And we have a great chef. Her name is Chef Kiara. And she's well versed and gives tons of advice on, foods that you can eat that are beneficial for you relative to the seasons, the time of day, particular disorder, your age, your overall constitution, based on, like I said in the beginning, when you were born, the time of day you were born, the season you were born in, the year you were born in. These things are very important. It's very important. And the more you become aware of and more in touch with your body, you'll be amazed as to how you can figure out how you can heal yourself. Because, you know, the human organism, I mean, our bodies communicate. Stomach, brain, stomach, first and second brain. Constant communication. This is wrong, so put this type of food inside of it. This is wrong, so increase the amount of water in which I consume every day, or at a particular time, even. This is wrong, so the body requires rest. Your body is constantly trying to tell you what's wrong and how to deal with it. And we've become so detached from this reality because we're caught up with all types, aspects of media that have put a wall up between the first and second brain. See, so the body can say, increase the amount of beetroot to clean out the blood because the liver's overwhelmed and toxic, and the rejuvenation process when you sleep is partially impaired as a result of. So I need help with what we ingest, and that signal goes off. And we've been brainwashed to not pay attention to this form of communication. So we just take it as, okay, I'm hungry. It says eat something. You just pick up anything and just put it in your mouth and boom. No, it's not the case. Because the body does get specific, but if you don't realize that, then that means that you've really lost touch with your body. And this goes back to when I said earlier, you know, when you become proactive in educating yourself about health and the different types of medicine, but you start with anatomy and physiology, because once you learn what the human organism is made up of, the different types of cells and its functions, and so forth and so on, and traverse your body, it'll blow you away, because the body is designed to repair itself. You really don't need a great deal of medicine. Maybe in emergency situations, life or death situations. You know, there's certain things that we just can't control. We can't control, you know, if a drunk driver hits us with their car or whatever the case may be. We can't control it. So you have to understand that life is positives and negatives to everything, because, you know, without polarity, there is no existentialism. There's no one exists. Nothing exists. There's good and bad, yin and yang to everything. But, and you know, I actually, well, I wanted to say, I don't want to be absolute in that statement, and I try not to be absolute about anything in life, because it is my belief that nothing is absolute. But when it comes to smoking, the only attempted positive, and I really don't want to put this out there, to give you guys a crutch that do smoke is that, it distracts and it can take your mind off of, whatever stress factor that is ailing you or consuming you at the moment, at the time. But there's other ways. There's other things that we can turn to that's much more healthier. Like meditation and even massage. Just, think about how much you spend on cigarettes per week and take that and get yourself a nice 1-hour massage every week. And you'll be shocked as to what a change has come over you. And more likely than not, you'll forget about cigarettes. You'll gladly throw away the packs of cigarettes. Whereas when you go in the store and you think about ordering it, for one, you'll get that one word will come to mind. Nope. I want my massage at the end of the week. And if I take this money that I budgeted for cigarettes or budgeted for massage and use it on cigarettes, then I can't get my massage at the end of the week. So it's interesting. But guys, I hope you've gotten something out of this podcast with regard to smoking overall, as well as smoking during this pandemic. And that's the positive to this pandemic. Well, you can use it to stop doing things. It's a good excuse for you to use to stop doing things that have been negative to you preceding this pandemic, such as smoking is one. Now, Wednesday's brunch hour with Acupuncture is My Life, I'm going to talk about drinking alcohol. Nope. I'm going to actually move that to Friday's brunch hour because Wednesday, I've got awesome write-ups from Chef Kiara about how you can utilize Eastern nutrition to cure or better manage certain disorders, and how you can live a healthier life, and the colors of food. Why is it so important, the different colors of food that you eat pertaining to the taste, like bitter, spicy, salty, sweet? How is it all relative to good health? I want to get into that on Wednesday and several Wednesdays going forward. The Acupuncture is My Life brunch hour. I'm going to talk about Eastern nutrition. And let's see how much you allow that to change your life. And now my brunch hour is normally at 11 a.m. Eastern Standard Time. So brunch here on the East Coast of the United States, it's not brunch in California or in Europe or China or Africa, because we have listeners around the world, so just be aware of that. And I'm going to start answering questions in future podcasts because there's tons of you out there that have lots of questions pertaining to your health and how Chinese medicine, and particularly acupuncture, can be beneficial to you. But the only way you can submit a question to me is by going to the Google Play Store and downloading the Acupuncture is My Life app. I will only be taking questions that are sent to me via the Acupuncture is My Life app. And also another benefit to having the app is you get free telehealth services. Because if you don't have the app, then, you know, Acupuncture is My Life charges a fee for telehealth services. And yeah, but guys, I hope you learned a lot from this. And stay safe out there, be well. And I'll be speaking to you on Wednesday at the Acupuncture's My Life brunch hour. Because acupuncture is my life. What's yours?